Hi, Wayne Williams here from Profunda Analytics. Today, we're going to demonstrate the power of comparisons. You're the administrator for a retinal practice. You've already identified that Dr. X is losing the most patients in your practice, and now you want to find out why. Let's get you familiar with the starting interface. You're looking at data for an individual physician. The upper graph breaks the physician's patients down into 3 buckets over time. The green line represents patients that the doctor has seen within the past 6 months. The blue line represents patients the doctor has seen within the past 7 to 12 months. The orange line represents patients that he hasn't seen for 13 to 18 months, and these are considered lost patients. Ignore the bottom charts for now, we'll get to those shortly. The problem with the upper graph is that it lacks context. Are these numbers good or bad? We can provide that context by comparing this doctor's numbers against other doctors in his practice, where the dashed lines represent the comparison figures. We can also look at other doctors in the region or other doctors nationally. When we use the national figures, we see that the gaps between the 2 green lines and the 2 orange lines widen significantly. This means that fewer of the doctor's patients are considered current and more of them are considered lost, both by a significant margin. The question is, what is causing this? We might be able to answer this question by using these filters in the upper left. For example, if we looked at only age-related macular degeneration, or AMD, the current patient gap widens, while the lost patient gap narrows significantly. But if we look at males over the age of 90, we find that the gaps disappear almost entirely. The problem with this approach is that there are over 4,000 combinations of just these 4 filters, so going through them one by one could be very time-consuming. Instead, we're going to right-click the upper graph like this and use a little helper screen called Patients Lost as of current month. This screen shows all combinations of relevant filter criteria, but orders them by percentage of patients lost. Initially, it shows what I call junk combinations, i.e. combinations involving very low patient counts. But if I set the minimum patient count filter here to 10, it displays more meaningful combinations. These combinations now add up to hundreds of patients for this doctor, where patient loss percentages are in the 50s and 40 percentiles, well above national averages. When I look at the 4 filter columns to the left, here's what I see. I see a combination of patient insurer type, private, public, and mix. When I look at gender, I see a mix of male and female. When I look at patient age range, I don't see anything consistent here either. But when I look at the condition column, I see the condition diabetic retinopathy, represented by DR, showing up consistently among these high patient loss percentages. I can confirm this by setting the filter to DR, and if I go across the physician patient loss, I see that indeed they have high losses in the 50s and 40 percentiles compared to the teens nationally. And if I switch back to the line chart, I can see visually that this is definitely one of the problem spots for this doctor when it comes to patient turnover. So we've found something worthwhile to look at. This concludes the child's play portion of comparison features in this demo. Now we're going to employ far more sophisticated comparison techniques to figure out exactly what is going wrong with DR patients. To do that, we're going to turn our attention to these lower graphs here. This first set of graphs is not particularly interesting. They show us that the doctor has on average more total encounters per patient, but this is easily explained by this graph on the right, which shows that he also has a longer length of relationship. He may simply be a doctor who has been in practice for a long time. The graph in the middle, showing the days between visits, appears at first glance to be a mixed bag. Our doctor has a longer visitation cycle for current and lost patients, but a slightly shorter one for those patients seen in the past 7 to 12 months. However, there is a hidden piece of information in this chart. The line our doctor is aspiring to is this dashed green line up here. The visitation cycle for that patient group is 66 days. The line he's trying to fix is this solid orange line here. The visitation cycle for that group of patients is 82 days, as shown here. That 16-day difference may be significant. For now, we'll just file that observation away and look instead at treatment types used by physicians, which we do by right-clicking this graph and choosing treatments. This is a far more interesting set of graphs. It shows that our doctor uses anti-VEGF treatments only about a third as often as they are used nationally. Whereas if we look over here at laser treatments, we see the opposite. He's using laser at almost 3 times that they are being used nationally. In other words, our doctor is using a different treatment regimen than the typical treatment for diabetic retinopathy. The question is, are his treatments more successful? To check that, we look at visual acuity. Visual acuity is basically a mathematical expression of eye chart exams. In this system, lower scores mean better vision. If you look at this chart on the left, you'll see that our doctor's patients start off with slightly worse vision on average than the national average. But if you go all the way to the right, you'll see that the gap in visual acuity increases relative to national average. This means that our doctor's patients are suffering more vision loss, which might explain why they are leaving him. This next set of charts might be the most interesting of all. What they do is break down all the different treatment patterns over the course of patient histories, then compare the patient retention or loss for each. For example, this first group shows patients who only use anti-VEGF drugs for treatment, represented by the acronym AV. The group beside it has an acronym of AVLS, meaning the patients received anti-VEGF drugs and laser treatment at the same time, and so on for the rest of these groups. The purpose of this chart is to make sure that we are comparing apples to apples when it comes to treatment regimens. And here we get a bit of a shock because even when our doctor is using the same treatment used by most doctors nationally, and anti-VEGF drugs only, his patient retention rate is still much lower at only 51%, compared to the national retention rate of 86%. That doesn't make sense. With the same disease and same treatment regimen, we would expect the same outcome. Speaking of outcomes, we can also check the changes in visual acuity by treatment pattern. Remember, positive numbers mean worsening vision, while negative numbers mean improving vision. Again, what jumps out at us here are the results for patients who received only anti-VEGF drugs. Our doctor's patients appear to have suffered significant vision loss in their first 6 months. This 0.4 equates to about 4 lines on a vision chart. While nationally, patients receiving the exact same treatment enjoyed slight vision improvement. This example is so egregious, we have to drill down on it to look at the details, which we do simply by clicking it. Now we're looking at all the interactions and treatments, etc., for the treatment pattern anti-VEGF drugs only. And here we see a couple of huge gaps opening up. Remember how the days between visits comparisons were a muddled picture before? Now that we're looking at pure anti-VEGF patients, we see that our doctor uses a consistently longer visitation cycle than doctors do nationally. Even worse, when we look down here at treatments, we see that the difference in injection cycles is huge, with our doctor injecting once every 100 days or so, while the national average is closer to 50. For those who know anti-VEGF drugs, we know that a 100-day injection cycle is way too long. The drugs won't be effective on that kind of an injection cycle. So now we have some pretty compelling insights into what is happening with this doctor's DR patients. First, he's treating them differently than other doctors are treating them. Second, even when he uses the same treatment, his patients aren't sticking with him. Part of the reason for this may be because those patients are suffering significant vision loss in their first 6 months of treatment. And this may be explained by the fact that our doctor is not using anti-VEGF drugs in the recommended fashion, and certainly not consistent with how doctors are using them nationally. What's amazing is that we've been able to uncover all of this without using data scientists or even advanced analytical algorithms. All we've done is let the user compare our doctor to other doctors on a fairly sophisticated level. That's the power of using comparisons.